Hi there. I'm here to talk to you a little bit today about our project and our analysis, the Diabetes Prevention Program, an effective intervention for those with prediabetes. I'm going to start here at the background section. So essentially what we wanted to do is, in conjunction with several clinicians, several medical students, and one of our statisticians, we wanted to take a look at the Diabetes Prevention Program that is held at the St. Vincent de Paul Medical Clinic. To take a look and see if this program was effective in preventing the conversion of a pre-diabetic patient or a patient at risk for diabetes to a patient with diabetes. We were prompted to look into the results of the diabetes prevention program at the St. Vincent de Paul Clinic because of the NIH diabetes prevention program outcome studies that showed that perhaps there weren't real long-term benefits in preventing diabetes. Rather, the diabetes prevention program appeared to delay the onset of diabetes in patients who participated in the program. So we went about separating our patients and the participants in the diabetes prevention program into two separate groups. We had a control group who completed less than 12 classes, and then we had the intervention group who completed greater than or equal to 12 DPP classes. Then what we ended up doing is we ended up contacting those participants, and asking them to come back into the clinic where we would collect follow-up biometric data. So getting additional hemoglobin A1Cs, of course, getting their height and weight again, as well as their blood pressures. And then we also administered a health behaviors and attitudes survey that we designed to see if the diabetes prevention program had influenced the attitudes and the way that participants perceive their health and perceive their exercise habits and pursued them and adhered to them. So once we had patients come in where we could get follow-up information on them, we ended up doing statistical analyses on this information. So we did some t-tests to compare several biometric values. We did a few ANOVAs, and then we also ended up running a few regressions as well. So when we're looking at our results, I think the most important take-homes here are, first, our survey subscores. So it appeared that the control group and the intervention group really did not have any significant differences at all in their self-reported behaviors regarding to keeping track of calories and keeping track of their diet, limiting their carbs, limiting their salt and sugar, watching the fats they consume, and adhering to the MyPlate program. Now, looking at hemoglobin A1C at follow-up, it also appeared that they did not have any significant difference whether you participated in the DPP or whether the patient did not participate in the DPP at that follow-up hemoglobin A1C lab value. BMI change, unfortunately, was also insignificant at this time point. And looking at weight change, the weights initially prior to DPP were not significantly different, but appeared after 16 classes, after the post-16 class time point, they appeared to be significantly different between the intervention and the control group, but this difference, the significant difference, did not exist at the follow-up time in which we called patients to return to clinic. What we concluded from this is that really belonging to the intervention group and participating in the diabetes prevention program, one, did not show to affect the type 2 diabetes incidence, hypertension incidence as well, which we looked at, BMI change, or participant self-reported health behaviors or attitudes. So taking all of this information and trying to make sense of it in the context of this program, I think our study and our analyses, in addition to the analyses from the NIH study, the Diabetes Prevention Program Outcome Study, suggest that perhaps the diabetes prevention program delays the onset of diabetes, but it does not look like there's any significant difference between the control group and the outcome group in our study or in the diabetes prevention program study in the number of patients that ultimately convert from prediabetes or at risk for diabetes to diabetes. So we suggest perhaps renaming the program rather than saying diabetes prevention program, which suggests that diabetes is being prevented entirely. Maybe we call it the diabetes delaying program, just so that individuals who are participating, individuals who are adopting this program into their practice or into their clinic, their health center, can have a more representative idea of what they're going to administer to their participants.